He is the doctor over at the Comprehensive Blood and Cancer Center, one of the best, if not the very finest, not only in Bakersfield, but I would say California and the nation. Dr. Ravi Patel, good afternoon, sir.
Good afternoon, JR. It's always a pleasure to speak to you. I want to be as influential and powerful like you to make a difference in people's lives. You always are so upbeat and do such a great job for the people.
Well, I appreciate you saying that, Dr. Patel. I was in your office actually about a month or so ago. I was invited in to take part of the Know Your Numbers campaign for men to get your PSA numbers.
And did they take good care of you?
Oh, they took fantastic care of me. Are you kidding, Dr. Patel? It took less than 5 minutes. I was in, they drew some blood really quick and they had me in and out. And then not only that, but I got my results back by that afternoon.
And they told you they were good.
I'll play it for you, Dr. Patel.
Hi, JR. My name is Susie, calling from Comprehensive Blood and Cancer Center. I'm one of the patient navigators here. And I just wanted to call with some really great news. We did get your PSA result back today, and it is within the normal range. It's at 0.53. Normal is 0 to 4. So you're in really great shape.
That's the part I like, Dr. Patel, where she says you're in really great shape. I keep that and I play that for everybody.
That's very good. And we're so happy that you got the results as normal, and they're quite low, which is a good sign. Very good sign.
Yeah, that's what they told me. So I'll continue to follow up. I don't really have any history of prostate cancer in my family, but I'll continue to do the follow-ups. And I know because I turned 45 this summer that I'll need to get those screenings more often.
And then don't forget the colon check will be coming also.
Yeah, when should I do that?
I think it's about time. They recommended around 50.
Okay.
If you have any changes in your bowel, if you have any discomfort, any blood in the stools, if you notice that your stools are changing, or you have some difficulty with bowel movement, it's always good to check it out. But I think you're good. And it's always good to have a variety of foods. Not a lot of McDonald's all the time, but a variety of foods, fruits, veggies, white meat, red meat also you can enjoy. But it's always good to get farm-fed beef. That is better than the fast food.
Right. Oh, of course. Anything processed. You want everything as fresh as you can get it.
Correct.
And then mix in a little bit of exercise, take some walks, do some push-ups every once in a while, and you'll be in good health.
Yes, you'll put us out of business by doing that.
Oh, I think you're doing great business over there. Enough about the men, though, Dr. Patel. It's all about the women this month.
Yes,
it is October.
They're important this time. Yes.
Yeah, last month we did the PSA numbers for guys. This month it's October. It's breast cancer awareness. So I'm wearing my Houchin shirt. I gave platelets on Friday, and so I got this cool shirt. It's got the pink hot rod on the back, and it even got CBCC on the bottom of it. Because I know platelets go a lot to some of the cancer patients and helping out. And they're
Thanks for doing that.
oh,
Nice.
I do it in honor of my father. He passed away to cancer back in 2009, and so I try to do it at least half a dozen times a year in honor of him. And my sister is also battling cancer in Las Vegas, and so she in honor of both of them, I try to give because I know how important it is to those patients.
It's critically important, and it will not be forgotten because it's an important thing you're doing to help others with the transfusion.
Yeah.
Much needed.
Oh yeah. So I've got the pink shirt on. We've got the pink in the back. We've got the pink logo going and everything. All in bringing attention to breast cancer awareness. Talk to me about how you guys are doing that, and just go over some of the things that women should be doing. Like when should they get just kind of a baseline mammogram?
Yeah, it's a good idea to do the mammogram around the age of 45. Some people say 50. If you have a family history of cancer, you can do it earlier. But it's also very important that you do a regular self breast exam. And The best time to do it is when you are in the shower. And if you notice anything, any unusual lump or bump, either on the breast or under the arm, then bring it to our attention or call and speak to your primary care physician. Also, if you notice that there is some changes in the nipple area or discomfort, that also should not be ignored and should be checked out. And very critical that people do, if you drink in moderation, exercise, and always try to keep your weight down because these reduce the risk of the cancer. And most importantly, it's also critical that you don't forget doing your mammograms on a regular basis. It has to be done once a year so that the breast can be checked and evaluated.
Yeah, because that early detection is very, very important when treating this, right?
Absolutely. The earlier we pick it up, we sometimes see, unfortunately, that something was going on, and by the time they come in, there's some swelling under the arm, and that indicates that some of the lymph glands may be involved with what's going on in the breast, and your cure rate goes down if you don't pick it up early. And that's why a good breast self exam is important, the mammogram is important, and then if you notice something, drive everybody crazy to get in and get checked out.
Yeah, yeah. Because, like I said, the earlier you find out, the better you have a chance of surviving. Not only that, but with these new treatments that you guys have come around with. Talk to me about some of those new breast cancer treatments and stuff.
Oh, yes, I'm glad you're moving in that direction because that's also important that once if you have cancer, what can we do? Well, there's so many things we can do. One of the most important thing is you don't want to use an elephant gun to kill a mosquito. So, it's important to find out how aggressive the cancer is and how extensive it is. So we can do some very specialized genetic testing to really figure out whether the cancer is extremely aggressive or not that aggressive. We can also identify, based on the genetics of the cancer, what kind of drugs would be more effective for the patient. Surgery is always the first choice to remove, but following surgery, you have to follow it up with other treatments, either in a pill form or in the form of chemotherapy. And a lot of people have an impression that I've got breast cancer, so I'm just going to get my whole breast removed and I don't want to deal with this. Well, that really is not necessary nowadays. You do not need to remove the entire breast except in certain situations. So the most important thing is removing it, doing the testing, but you really do not need to remove the whole breast. Of course, if you do scans and you find activity in other parts of the body, then you have to again look for treatment with medication rather than the surgery.
Right, and those treatments, like you mentioned, are chemo and some are in pill form now. What are some of the advances that you guys made with radiation therapy?
So, a significant advance is that whenever you get breast cancer on the left breast is very close to your heart. And in certain situations where patients need radiation to the breast, we have a specialized technique which is called prone radiation. So you don't need to lay on your back and get the radiation. We can have you lay on your stomach and still be able to deliver the radiation to the breast. And by doing that, you protect the heart from getting any exposure to the radiation. So it's a very unique way that we are able to do that. We do that here at CBCC for patients who have left-sided breast cancer and need radiation.
Nice. That's and every case is different, right, doctor? That's why
Yes,
that's why there's so
yes,
many options.
yes. That's the important thing. Every case is different. So, you could get away if your cancer is not involving the lymph gland. Uh, Sometimes you can get away with just a pill. Sometimes, if the lymph glands are involved, then you do need to get chemotherapy. And a lot of patients are very fearful about chemotherapy, but it's very important to remember that in this day and age, people can get chemotherapy, but continue to live meaningful lives and can still be active, can still socialize, and the treatment can be given in such a way that the side effects can be minimized. And if you do develop complications, you can closely correct them by monitoring them.
And that's the key. Monitoring, early detection and continued monitoring is what's gonna be very beneficial to your battle there.
Yes, it's an important part, and don't get discouraged if something were to change. There's more and more new treatments going on. We're also doing quite a few uh, clinical trials for some of the very aggressive breast cancers here at UCLA, here at CBCC, along with UCLA. So we do a lot of clinical trials, and clinical trials are safe as long as or you have exhausted standard treatments. And sometimes people wonder whether they can get onto a clinical trial. And yes, you can. And the best time to get onto a clinical trial is if you have certain kinds of aggressive breast cancer, or if the breast cancer has come back and you're looking at other options, then it's a good idea to look at that. And we work with UCLA very closely on several new drugs for breast cancer. And in the past, we've worked with UCLA to develop certain medications which are used for breast cancer today. And we owe it to our patients in the community that they participated in these clinical trials. And by participating in these trials, these medications got approved, and our patients in Bakersfield are helping patients all across the world in a way by allowing these drugs to be approved for new treatments for breast cancer.
And that's all thanks to you guys too and your guys' work over there at the Comprehensive Blood and Cancer Center, also known as CBCC. Tell us about some of the promotions. I know you got a bunch going on for women to take advantage of all month long to low cost mammograms, 3D screenings, financial assistance, and the big one tomorrow going, the Pink Party in Wonderland.
Yes, I'm glad you brought that one up. It's, your journey of cancer does not need to be just in tears and sadness. What we want is celebrating those who have breast cancer for who they are, what they've done with their lives, and also serve as an inspiration to other friends they have who have breast cancer and show that they can continue living and enjoying their lives. So we have this event. It's called the Pink Event in respect for all of our beautiful ladies going through this difficult journey. And it's organized here at CBCC, right in front of our building. Lots of festivities, camaraderie, fun times, and you're welcome. And mainly just make sure that you can enjoy your life celebrating with other breast cancer survivors right here outside CBCC.
Yeah, get over there tomorrow between 5:30 and 8:30. It's at 6501 Truxton Avenue. It's the Pink Party in Wonderland. They'll have all kinds of stuff for you guys to do. Thank you so much for stopping by today, Dr. Patel. I appreciate all that you guys are doing over there at CBCC.
Thank you. Thank you so much.
All right, we'll talk to you soon, doctor. Thank you so much.
Thanks. All the best to you.
Oh, same to you, sir. Thank you. Thank you. And if you guys need to make an appointment, just call 661-616 1643 to schedule your October screening mammo today. They've got cash pay for $80, 3D scanning mammograms. Like I said, they also offer financial assistance provided by Links for Life. They're going to be doing weekly raffles all month of October. Every Friday, they're going to do another raffle where you could win. All you got to do is get in and do that mammogram. Call 661 616 1643. That's Dr. Ravi Patel with the Comprehensive Blood and Cancer Center.